Welcome back to AM Northwest. You know, when it comes to our health care, it's critical that we know how to advocate for ourselves. Here with expert tips on how to do that, we welcome back the author of All in Her Head, renowned medical oncologist Elizabeth Comen. Good to have you with us again. Great to see you. You know, I think that oftentimes this kind of misconception that we have is that doctors always know best and more than you do.
Yes. Well, thank you again for having me.
You bet.
On your Delighted to be here. It's a complicated dance. And, you know, as someone who's went to school for forever, it seems, in many instances, medical specialties, we are highly trained. We go to school for forever to have that expertise. But ultimately, it's about the doctor-patient relationship and the communication, because you know your body in ways that your doctor or nurse practitioner will never know your body. You live in your body. And the best type of medical care is when we can combine what patients know, what they're worried about, what questions they have, what their instinct is about their body, with the medical expertise that we've worked so hard to gain.
Right, and I don't mean by that a patient knows more medically, but the patient knows about their body, but sometimes they feel dismissed, like it's nothing, it's all in your head, as your book is titled, you know, that kind of thing. We just need to be able to say, this is how I feel, and it's for real.
Exactly. And particularly for women, we know there's a long legacy of women being dismissed, invalidated for so many female-specific conditions, being misunderstood and often diagnosed. I think what you're really speaking to is the importance of having the space to be able to say, this is what's worrying me, this is what I think may be going on, and having the type of dynamic with your doctor where they can unpack that, reassure you if necessary, explain to you why they think you're really okay, or do the proper tests and diagnostic tools to understand what else could be going on.
What do you suggest women especially do when it comes to healthcare and dealing with a medical team?
It's a complex, imperfect medical system right now. I think, first of all, if you're nervous, especially about a new diagnosis or anything that's going on, bring a friend with you, bring a family member, bring somebody else who can help advocate, and come prepared with questions. Because I don't care if you're Einstein or how smart you are, or even if you're a doctor yourself, when you're in that doctor's office and you're worried, it's incredibly hard to absorb information and make sure that you're asking the questions that you want. So bringing somebody with you can help be another extra set of eyes and ears. I also say in our current system today, it's important to know who is on your healthcare team, because sometimes the doctor really can't do it all. You need to know who's going to be scheduling your appointments. Is there a nurse you may interface with, or a nurse practitioner? And also, what's the best way to communicate with your team? Now we've got all these different options of maybe portal messaging or my chart systems or emailing.
Yeah.
Technologies. So it's important to know what's the best way to get in touch and who's going to be getting back to me.
So you mentioned coming prepared with questions, also bringing the friend who can take notes so that you can deal with the emotions and they can deal with the facts.
Exactly. And, you know, there's a recent act called the Cures Act, which means that you may be getting your medical information, your lab tests, your imaging tests before your doctor has necessarily had a chance to even look at them. And that can be really overwhelming. If you're logging on to your healthcare chart and seeing lab tests or imaging results that can be hard to interpret, you want to talk to your doctor about when you're going to receive information and who's going to be communicating that with you, because it's very common that patients go off the deep end, start Googling and really are terrified by things that they wouldn't be terrified if they were speaking to a healthcare professional.
Oh yeah, that Googling can be dangerous.
I do it too. I've rabbit hole in the middle of the night. I've done it when I've been worried about my kids or some diagnosis for a family or a friend. It's so common, but remember that we wouldn't Google how to fly a plane and then try to fly it ourselves.
Right.
We gotta put context.
Right. Would you suggest that getting a second opinion is okay? Are doctors okay? If you don't like what they're saying or you're afraid of what the doctor is saying, getting a second opinion, is that a valid thing to do?
Let me be crystal clear about this. If you are seeing a doctor who does not want you to get a second opinion or makes you feel uncomfortable about a second opinion, they're not the right doctor for you. We are in it to help you. If you don't feel comfortable, if you feel the need to seek another opinion, that's perfectly within your right and often a very good idea. I welcome patients getting second, third, fourth opinions, particularly for complicated diagnoses. We work together as a team. So absolutely, you should feel empowered always to seek the kind of care that you need, including second, third opinions if necessary.
Sometimes too, I've heard of, doctors don't have, there's some doctors may not have the best bedside manner, but they're great doctors. But I think, don't you have to feel comfortable with that person in general?
Yes, comfort is very individual, and every doctor is human. We have great skills in some areas and
Right.
maybe not. Everyone has to decide what's right for them and what constitute a great doctor for them. And sometimes the healthcare team can fill in what other aspects of the doctor-patient relationship the doctor may not be meeting for you.
Can I ask this question? Let's say you feel like there's something that's really bothering you and you need some sort of scan or something like that. And the doctor says, well, no, not until we see this. But you want to do something preemptively. Is that a possibility? How would you make that happen? Because sometimes people think, oh, this is what's going on. The doctor says no, insurance won't pay for it, or whatever that may be. Insurance may be leading the game there too. What are your thoughts about that?
This is a common question I get in the cancer world, but also can apply to other things as well. In cancer, for example, we may do CAT scans or MRIs or
Right.
PET scans. And lots of us could say, well, should we just walk around getting a PET scan every month? Why wouldn't we do that to catch cancer? There are reasons, very complex reasons why we don't just image things all the time. Depending on what you're concerned about, your doctor may be having a very important rationale for why it doesn't make sense to jump to image. So I would ask your doctor, can you explain to me a little bit more why imaging may not be appropriate right now? Is an insurance thing, or has a different rationale, like it's not going to help me? For example, if you have back pain that's relatively new and you get an MRI, it may show findings that could be old, totally unrelated to the pain that you have right now, but it can signal or start a spiral and rabbit hole of other diagnostic tests than you don't need.
Yeah.
So what I would say is talk to your doctor to understand, why is it not recommended? At what point would imaging be recommended? And if you're not comfortable with the answer, get another opinion.
Yeah, excellent points. I want to tell everyone again, the book is titled All in Her Head, Dr. Elizabeth Comen. Thank you so much.
Thank you for having me. Always a pleasure.